More and more people are delaying their families because of work pressures or lifestyle changes and delaying getting married. So, marriage is not so important for them. Hence, there is a need to preserve your fertility, and the fertility can be preserved by preserving your eggs or oocytes. So, lot of girls are going for egg freezing, and this can only be done when you are in your fertile period, that is say between 25 to 35 years of age or 40 years of age, after which the oocyte quality starts deteriorating. So in case the woman decides to delay her pregnancy or delay her getting having a child, then eggs can be taken out, they can be retrieved outside, and they can be cryopreserved. These eggs at a later date can be fertilized with a partner's semen. Embryos can be formed, and these embryos which are formed can be transferred at a later date. And this option gives you a chance to become a mother with your own eggs and not using the donor eggs, which is not a very good option, and it is not acceptable to lot of our women, and they would like to have a child who is genetically theirs. Hence, social egg freezing is becoming very common method of ART or assisted reproductive technology. Thank you.